And a lot of people think that sexual dysfunction mostly comes from the blood vessels, but the majority by far, like more than 80% of erectile dysfunction and sexual dysfunction actually comes from the brain. If you had no sexual drive or sexual interest or anything, the brain's not going to send a signal down through the vagus nerve and allow that blood vessel to constrict, right? It's just the brain will just stop it from working, and that's actually the majority.
Hello, everyone. Welcome to the Fixed Blood Sugar webinar. We are excited to have you here for our weekly webinar where we talk about type 2 diabetes. And we talk about a lot of other things too, but that is our primary focus. And so every other week, we kind of hone in on a topic that a lot of you have asked us about, or that has come up in some of the chats that we do with some of you. And today's topic is sexual dysfunction and type 2 diabetes. And so we get questions about this. I don't know that we've ever done a webinar on this. And so maybe we've talked about it a little bit, but this is going to be very informative. We look forward to some of your questions. And you're going to have Dr. Saunders do a little bit of teaching as well, just like he always does. Let me see. Yes, it looks like we have lots of you hopping on. I'm going to go ahead and make sure that the chat is working, because sometimes we have some problems with that. Before we get started, Dr. Saunders, would you give us a disclaimer while I do some of this stuff on the back end?
Okay, so on this program, we talk about a lot of issues, a lot of problems that people have, and with very specific information on certain drugs and certain supplements and certain treatments and ways of doing things. But they may not apply to you specifically. So it's really important that you have someone to help you to decide, does that apply to me, or should I use that, or is that right for me? So it's not that anything that we say here is right for everyone. It's make sure to apply it to you specifically, because what we're giving is just general information.
Great. All right. Lots of you are saying hi. That means our chat is working. Olivia's on. Awesome. Vince, David, the Garcias, Greg is on. Awesome. Awesome. Good to see you guys. Well, I can't see you, but I know you're there. Again, today we're going to be talking about type 2 diabetes and sexual dysfunction. And so while some of these things may be a little bit sensitive to talk about, I do want to give you guys an option. Feel free to post your questions in the Q&A, but if you have something that you maybe want to ask but want to keep it anonymous, there is the chat feature. You can choose to send me a direct message or to the hosts and panelists. And if you choose it that way, then we can just read the question without maybe saying your name, even though this is it is online. So you may want to do that, I guess. But before we get started, let's just do a quick overview of what is happening in our body when we have type 2. I'll let Dr. Saunders do that.
Okay.
Can we do it quick? I don't know.
I thought you were going to do it. Okay. So what is happening with type 2 is the easiest way to say it in one word, you could say toxicity. And what is toxicity? Well, toxicity is anything that's toxic. And toxicity is any chemical in the whole world is toxic if you get too much of it. So in this case, we're talking about toxicity of sugar primarily. But it's not just sugar, because there are toxic potentiators of sugar like fat. Fat makes sugar much more toxic than it would be otherwise. In fact, people who live on, like fruitarians that live on just fruit, they have a lot of sugar every day, 100 grams plus of sugar every day. And they never get toxic, and they never have diabetes, never. Like it's unknown in those groups of people. Why not? Because they never eat any fat. And fat is what makes you resistant to insulin, so that the sugar becomes then toxic. So this is a combination of factors that are involved in this, and not just one. So this toxicity that we have is the general thing that's going on.
Interesting. Okay. Fruitarian, add that to your list of vocab words. I think we've mentioned that maybe once or twice, but we've been doing this for like 3 years, so it doesn't come up very often, but it's always amazing. Everyone does kind of eat a little differently depending upon where you go. So good information. If you're new today, you can go to bartonwebinar.com. There is a link to all of our past webinars, and you can search those by topic, but you can get a lot of information where we really dig deep into what's happening with your body when you have type 2, what your options are, etc. And so let's go ahead and dig into this topic, type 2 and sexual dysfunction. So you have many patients that come in to your office with type 2, or maybe they don't even know that they have type 2, and they may be noticing some things that are happening. So before someone, we hear about some side effects of drugs, but what are some of the side effects of just having type 2 that we may not realize?
Okay, so in terms of sexual dysfunction, it's kind of a common problem, but a lot of people don't go to their doctor. They just deal with it in whatever way they deal with it, and sometimes their partners. I've had people come in where the partner will tell me, hey, he's having a problem with erectile dysfunction, and I've been seeing this guy for months at least. I don't know, maybe even years, and he never said anything about it. And so sometimes it's a sensitive issue for the person, because what do they call erectile dysfunction? Impotence. And the word impotent means what? Powerless. That's literally what it means, is powerless. And so that idea of oh my gosh, I'm impotent, I don't have any power. It's a very sensitive thing, especially for a guy. It's like guys work out and I got power, I can do things, and to walk around saying I'm impotent is kind of a negative thing, right? So it's hard to bring up. So what happens in diabetes, and why does this happen? Well, if you think of the sort of magical nature of how the sexual function works, it's amazing how a penile erection happens. And it's all based on blood vessels. You have some nerves from the brain. And a lot of people think that sexual dysfunction mostly comes from the blood vessels, but the majority, by far, like more than 80% of erectile dysfunction and sexual dysfunction actually comes from the brain. Because the brain starts it off, that's where the emotions are and the control, and it goes through the vagus nerve and goes down, and it causes blood vessels to constrict, the veins to constrict, so that the arteries are still pumping blood into the penis at 120 psi, right? 120 millimeters of mercury to 150, and then but it can't come out, so it's going in and it can't come out, so it gets stiffer and stiffer and harder, and that's how an erection is made. And it's important to understand that, because then you can kind of understand what all of the factors could be involved of why that wouldn't happen, why it would stop happening. If you had no sexual drive or sexual interest or anything, the brain's not going to send a signal down through the vagus nerve and allow that blood vessel to constrict, right? It's just the brain will just stop it from working, and that's actually the majority. But then there are other people that have like high blood pressure, and they start taking blood pressure medications. What do blood pressure medications do? Well, they relax blood vessels. So what if your vagus nerve says, hey, constrict, but the medication is saying, no, can't do it, no can do. So that you only get this much constriction, and then you get a little bit of an erection or none at all, because of that blood pressure medication dilating the blood vessels and preventing that from closing down and allowing the penis to get stiff. So that that often happens, and especially people with type 2, when you're thinking about what is type 2, well, that toxicity doesn't just affect your blood sugar. We call it metabolic syndrome before you even call it diabetes. Metabolic syndrome is what? High cholesterol, abdominal obesity, high blood pressure, and insulin resistance. So you can have this metabolic syndrome and be put on a bunch of medications, and the medications can affect how your blood vessels work and prevent sexual function. So that's one common thing that people with diabetes have, even if the diabetes isn't the issue. It could be the blood pressure or the medication for the blood pressure. But also, there is an issue with the diabetes, specifically of damage to the lining of the blood vessels. And this slows down the blood flow and makes the blood vessels not work very well. So the blood vessels themselves don't work. And how do you know that? Well, we've talked on this show about neuropathy. What is neuropathy? Well, the vein or the veins, the nerves aren't getting enough blood flow, so you get tingling, numbness, weakness. They're just not working right because of a lack of blood flow. Well, if you have that same issue, you wouldn't be able to get a penile erection either. You would have sexual dysfunction for the exact same reason, that the blood vessels aren't working and you're not getting good blood flow, and they get stiff, and they don't, the nerves don't help them to contract very well. So because of that, just the high blood sugars or diabetes with high blood sugars damages the blood vessels to a point where then they don't close off completely and you can't get a good erection. Then what about women? Do women have sexual dysfunction with diabetes? As a matter of fact, they do. And this is for a different reason, though, entirely. The diabetes, as you gain weight because of the insulin resistance, insulin makes you gain weight. And as you gain weight, especially around the middle section, there's an enzyme called cyclooxygenase that makes your testosterone, DHEA testosterone, into estrogen. So it changes hormone balances. So as you change your hormone balance, then a woman's ability to respond sexually changes as well, and even the desire will change, so that she won't have the response that she normally would, or even the desire that she normally would. Because if all of the testosterone is being made into estrogen, then that would change how she feels too. And if you don't believe that, think about what happens during a woman's menstrual cycle. You have these cycling hormones of progesterone and estrogen, and when it's at a certain place, you somewhere in the mid-cycle, a woman is generally more responsive, feels more sexual, has more desire than at other times, like during the menstrual period, for example. And for some women, it's mild and they don't notice a big difference. But some women, it's huge, and they're like 2 weeks. It's like, get away from me! I can't stand you. And then the other 2 weeks, it's like, oh, come here. And it's like that bipolar kind of sexual sexual desire changes can be changed quite dramatically. Well, the hormones, as they change because of diabetes, can also have similar kinds of effects. So both men and women can have sexual dysfunction because of diabetes. Why is that important? Well, for me as a doctor, I don't care whether you have sex or not, but you know what? For a lot of people, that's a really important part of their relationship, of how the connection that people have, or that intimacy. And if you don't get intimacy, what happens? You tend to have more stress. And when you have more stress, then your blood sugar goes up. And so it can have a huge effect on your life, your lifestyle, the amount of stress, and how your blood pressure is, and your blood sugar control. I had somebody in here last week, and she says, I've never been married. I don't have any relationships. I'm not close to anyone. And her problem was she was dealing with PTSD. She had a lot of stress and post-traumatic stress disorder. And she had no outlet. She had nobody to talk to that she was intimate with, that she could be close to, that she could trust, that she could be with. And so we had to find other ways. How can we figure this out and find a way? Because intimacy is an important thing. So sexual dysfunction can exacerbate, make worse both the blood pressure and the blood sugar, and make diabetes worse, just because it can add on to the stress that somebody already has, or not give them an avenue to relieve that stress. Mm-hmm. So sometimes that's really important. So if it's important to you, then think about this. Why does it happen? It happens because of toxicity. It happens because of gaining weight. And it also happens because of damage to the blood vessels. So all of those things that we're talking about, when you go to the diabetes solution kit and you're looking at phase 1 of the program, and you're going, why do I have to detox? Why do I have to, I can only eat 20 grams of carbohydrates. I live for carbohydrates. I need bread. I can't function without bread. And so your why could be, you know what? I could restore my sexual function, and my blood vessels will work better. And that's how you know your blood vessels are working better, if your sexual function is restored. So that could be an incentive, right?
Yes, good information. And we're getting some questions here. I am going to just quickly show you the diabetes solution kit. This is what Dr. Saunders was talking about. If you're not familiar with this, most of you on this webinar right now probably already have this. In fact, I think we did a poll last time, and I think 90% of you had purchased the diabetes solution kit. But this goes through the different phases of how to reverse your type 2. And from the way it sounds, there's really no reason to not try to get out of a state of toxicity, right? The goal is to get healthy. And of course, there are a lot of benefits to it. But if you're interested in more information about this, you can find that at bartonwebinar.com. I also am curious, a question that came in was, let's see, is Viagra good for someone who has type 2?
Oh, that's a great question. Yes, there's several medications, and they are actually blood pressure medications. So Viagra was, sildenafil was being tested for blood pressure. And so it was given to all these people, and the guys were coming back saying, dang, ever since I've been using this for blood pressure, I'm getting good erections. This is really good. And so they stopped marketing it for blood pressure, and they just changed the marketing on it for sexual function, because of course that's going to be something that's going to sell really well. So for sales purposes. But when you think about it, yes, those medications, because they allow dilation of the arteries, and they don't affect the veins, they allow a good erection to happen for a lot of people, even with diabetes. So yeah, that can work.
Okay. This is a great question. So let's assume we have some of these sexual dysfunctions going on. Can they be reversed?
Oh, absolutely. Absolutely. Of course, remember that 80% of our sexual function is from the brain. It's our emotions. The emotions control it ultimately. And then the vagus nerve, that the rest of it's all anatomy. So as far as the anatomy goes, yes, it can all be reversed. You can clean out your arteries. You can make them soft and pliable again so that they function properly. You can lose weight and change your hormones. All of that is possible. But the emotional part is something that you have to work on separately with your therapist. That's a different issue.
One of the things that comes in, first of all, if you guys have started your journey with the Diabetes Solution Kit, or maybe you're using some supplements, or maybe it's the webinar that you absolutely love, I would love to hear from you. Would you please email me at leslie@bartonpublishing.com. I'll post that in the chat. I have been able to talk with a few of you, not a few, quite a few of you, just about your success and things that are going well. You've shared with me some of your side effects of different things, and some personal things. I think we've cried probably a few times on some of our chats. But one thing that I have learned is that there are prescriptions for type 2 that do have sexual side effects. Are you familiar with any of those, Dr. Saunders?
Well, yes, most of them are blood pressure medications. Some of the diabetes medications mostly affect the blood sugar, but not so much the sexual function. And since the automatic reaction that doctors are told, even if the blood pressure is normal, if it's a little bit elevated, that everybody should be on a blood pressure medication, that it's a common thing. But I think I'm not aware of any specific blood sugar medications that affect sexual function
Okay.
directly.
And it could just be that that people who have type 2 are experiencing those things and are assuming that it's from the medications. But we've found that people that I've chatted with after they have been on the Diabetes Solution Kit have started to get their numbers where they would like them to be. They're finding that things are improving. So that's awesome. Okay. Feel free, you guys, to post your questions again in the Q&A. If you want to send a private message so that no one can see it, you want to keep it anonymous, feel free to go to the chat. You can send a message directly to me. But Olivia is asking, can you get neuropathy even if you're not diabetic?
Oh, excellent question. Thank you. The answer is yes. That's the short answer. The long answer is the damage to the nerves and the kidneys and the heart and the brain is all happening long before your blood sugar is officially elevated to the point to call it diabetes. So there's a line we draw for diabetes, but way before that line, the insulin resistance is happening. So your insulin is going up and keeping your sugar pretty low. The insulin's going up a little more. The insulin's going up. You're getting more insulin resistance, and what that's doing is blocking the ability for the sugar to get into the nerves. So the nerves start starving. They start not getting enough energy. And your blood sugar is still normal, but the nerves aren't getting enough energy. So absolutely, yes, it can happen way before, or even people that have never been diagnosed with diabetes and their blood sugars are normal, hemoglobin A1C is normal, but they have enough insulin resistance to cause damage. And even we've seen kidney failure in people who don't have diabetes, but they have diabetic kidney failure, neuropathy, Alzheimer's disease, heart disease. Yeah, absolutely. Great question.
How does nerve damage that people have from type 2 um, interfere with their sexual function?
Okay, several things. So if you've noticed, like a neuropathy, we talk about getting numbness and tingling in the feet. That numbness means there's decreased sensation. And so if there's decreased sensation in the body, then the nerves that need to be stimulated aren't very stimulated. And the way it works is amazing, actually, when you think about it. Each nerve, in order for this nerve, so it's going along this nerve, and it's got to go to the next nerve. But in order to cross that gap, it has to reach a threshold. If it doesn't reach the threshold, it doesn't go across the gap. So you have to have a certain amount of stimulation to allow the neurotransmitter to go across there and then reach the other side and keep going along. And so what's happening is when there's not enough nerve stimulation and you have decreased sensation, then you're having only a few impulses going along there and it doesn't get to the other side. So it just doesn't work. And neurologically, it just doesn't work because you're not reaching the threshold that's needed to stimulate that and produce the amount of contraction in the muscle that you need. So you're only getting it partially contracted, for example, or even not at all if there's decreased sensation. So that's the nervous system, and that's how it works. Isn't that amazing?
It is amazing. We had a question about this last week too, about corticosteroids, and this says, does corticosteroids increase your blood? And what can be done to reverse the effects of this on my blood sugar balance? I got a shot for my frozen shoulder, and now my blood sugar is out of range. Please, what can I do, Dr. Saunders?
Okay, here's what you do. There's nothing you can do. Because it's causing you to be resistant to insulin. And what they injected you with is probably something like triamcinolone, which is 10 times more stronger, more powerful than your normal cortisol, right? So they call it a cortisone injection, but it's really a corticosteroid that is much more potent than a normal, your normal production of corticosteroids, your cortisol. So what you do is don't worry about it. It's going to have to come down eventually, and it will eventually come back. But if you try to chase it around and I'm going to inject insulin to get it down. They've done that in hospitals with patients in hospitals. And what they found is that the patient is more likely to have hypoglycemia and die if they try to normalize the blood sugar in people who've had corticosteroid shots. So yeah, don't mess with it. Just allow it to be 200. It's going to be 200. There's nothing you can do about it until it starts coming down after usually a short period of time, weeks to, I don't know, months is probably a long time, but within a few weeks, because the cortisone is injected in there and then it's kind of gradually leached out into the blood. So, and it's really potent. So it's not going to go away immediately, but it will eventually.
Okay, very interesting. One of the products that we actually have with Bart Nutrition is Niagara XL. And I'm wondering if maybe you can talk to us a little bit about this. Are there any benefits? What are the benefits? Well, of course there's benefits, but any information you can give to us about this?
Okay. So Niagara XL was created because of a demand for it, that people are going, okay, what can I do about this sexual dysfunction? And so we looked up of what things could be done. So there's quite a long list. It's the only one that we've ever put together that has a long list of ingredients. Most of them have, 2, 3, 4, just a few things in it. But this one, we looked at all of the things that are available. So one is, a part of it is to increase testosterone. And then some of the ingredients are herbs that increase libido, increase sexual desire. So mostly it's for men, and mostly it's for restoring that sexual function. Now, again, because of the way it works, part of it is on the physical part, like the testosterone, and then part of it is on the mental part, like the desire. And to tell you the truth, it's not going to work for everyone. And if you try it and you say, it didn't do anything for me, then don't think that more is going to be better. That's not the way it works. Either this is something that's going to help you. If your plumbing is not working, then this is not going to be your answer, right? So you've got to fix the plumbing first, or else it's just not going to work.
Okay, great. Question here from Anonymous. Does prednisone and Atarax increase or decrease blood sugar levels?
Prednisone will make you resistant to insulin and will increase your blood sugar levels. And just like the guy said that got the cortisone injection, prednisone is one of those. Cortisone, it's not as potent as the other ones, but it will still raise your blood sugar. And generally, for the amount of time you're on the prednisone, it will not come below 200 very easily, as a rule. So the other one, Atarax, is an antihistamine, and probably won't have much effect on the blood sugar. It shouldn't have much effect on your blood sugar. It can make you drowsy. It can have all the other. They use Atarax, even though it's an antihistamine, because it's sedating. They use it for anxiety, but it is an antihistamine. It's not a good long-term medication because it does contribute to Alzheimer's. But beyond that, it doesn't affect, or shouldn't affect, blood sugar much.
Okay, let's see. We have a question here, and we kind of already touched on this, I believe. Let's see. Do women also experience sexual dysfunction, and how does it affect their menstrual cycle?
Okay, yes. Well, see, for the same reasons we were talking about. It does, since it affects the levels and the balance of the hormones, estrogen, testosterone, progesterone, that it can affect the menstrual cycles, yes, and it can affect the libido, yes. So in the way hormones affect how women feel, so there's a lot of that. And then the menstrual cycle can definitely change based on the estrogen, usually excess estrogen. So it's usually in terms of having excess bleeding, more cramps, more feeling bad during the menstrual cycle.
Interesting. Okay. Just so you guys are all aware, Anku had mentioned that someone he knows wanted to sign up for the webinar. And if you have someone who might really benefit from this information, send them to bartonwebinar.com. They can sign up for this free webinar. It is every week. They'll get a reminder, just like all of you did who were on Zoom, I believe a week before. Wait a minute. No, a day before and an hour before, that will remind you of the webinar. And then all of our past webinars are also available on our YouTube channel. You can find a link to that at bartonwebinar.com. Okay, if you guys have more questions, feel free, again, to post those in the Q&A. I think we've gone through actually most of these so far. So here is one from Roy. Does neuropathy affect my eyes and or my hearing? I know a little bit about diabetic retinopathy, but is my decreased hearing also a neuropathy diabetic related thing?
Decreased hearing is not usually a diabetic thing. The retinopathy is a different issue. So yes, the neuropathy affects the eyes because the ability for the blood sugar to get into those nerves that are extremely sensitive, the eyes just, they have so much constant stimulation from this light going into them, all day long, every day, that the eyes are really sensitive to any loss of energy at all. So the retinopathy happens because of the loss of energy, because of the diabetes doesn't allow the sugar to actually get into the cell, because the glucose transport proteins are diminished. So that's the retinopathy. But the hearing part, tinnitus or loss of hearing, is usually a different issue. That's usually a central nervous system problem. In other words, it's not actually in the ears. It's not actually in the cochlea or the hearing organ. It's actually from the brain, and it's most often a different issue. It can be from toxicity, deficiencies of vitamins, but not specifically diabetes that I know of.
Okay. All right, good stuff. Let's see here. We talk about this a lot, but there are some new people here on the webinar. And can you give us an overview of the kitchen sink analogy? Because I really want people to understand what's happening when we're detoxing, what the goal of the diabetes solution kit is, because I feel like everything that we're talking about, lots of illnesses other than type 2, all lead back to toxicity. And so the visual of the kitchen sink analogy, I just think is so good for us to review and to keep in mind.
Okay, so you turn on the sink, and it's plugged and it starts filling up. And you're going, oh my gosh, it's filling up, and it starts getting higher and higher. And you're going, gosh, eventually this water should produce enough pressure to unclog it, right? It'll just start running down by itself, but it doesn't. It gets higher and higher, and then it starts overflowing. And then so you call the plumber and you say, hey, plumber, my sink's blocked up and it's overflowing onto my floor. So what does the plumber tell you? Well, the plumber says, of course, he's going to say, well, get a mop and start cleaning up your floor. So you get a mop and you start cleaning up the floor, and you're squeezing it out, and you're cleaning, and you're squeezing it out, and you're mopping, and you're working as fast as you can, but more is spilling out, and it's starting to get all over your kitchen. So you call the plumber. It's getting all over my kitchen. What can I do? I'm mopping as fast as I can. And he's like, well, duh, get another mop. And so you got 2 mops, and you're working on both sides, and you're squeezing them out as fast as you can. But it just keeps overflowing. Your sink just keeps overflowing. And so you call the plumber. The plumber says, well, get your wife in there with a mop, duh. And so you've got the whole family in there with mopping up the floors, right? That's the way modern medicine looks at diabetes. You're spilling over all this excess sugar because of toxicity. You have this sugar toxicity, and they go, oh, you're toxic on sugar. Your sugar's really high. Let's try and mop it up. So they give you something like, I don't know, Farxiga, so that your kidneys can't absorb all that excess sugar anymore. Or they give you something like a metformin, so that your body can't use sugar anymore, starts using fat. Or anyway, so they give you, there's a lot of other medications that cause you to make more insulin to mop up the excess sugar. And they tell you can just keep eating whatever you want. Just use these mops. And so you got one mop, one drug, and then they go, well, that's not working. Let's give you another drug, and get a second mop in there, and get another drug, get a third mop in there. And that's the way a doctor is taught to look at it. Instead of what would a good plumber say if your sink was overflowing? Well, just turn off the water, right? Just turn off the water. Stop it. And we'll work on the plug later. Just turn off the water. When you get the diabetes solution kit, all phase 1 is just how to turn off the water. It's not that hard. So we put you on a 20-gram carbohydrate diet. What does that mean? That's not enough sugar to run your body in a day. That's not enough. You can't live on that. So why is that important? Well, because you got all the extra, you got fat on you, and you have to teach your body. You have to first get all the toxic sugar out, and then you have to teach your body to burn fat again. Because insulin, because you have high insulin, insulin blocks your body from using fat for energy. So you not eating enough sugar to make a lot of insulin, so your insulin level goes down. You start teaching your body to burn fat, and so now you can use fat for energy, and then the all that excess sugar that's stuffed into the cells starts getting used up, and so the sink starts decreasing, and then as your insulin levels go down, then the sugar level drops easily, and your sink drains just like normal. And then what can happen? You go to phase 2, you can turn on the water again, and you can start eating things that have a little more sugar, and your blood sugar is not going to go up because you're sensitive to your insulin now, and you're not toxic anymore. So that's how our system works.
So good. Doesn't it make more sense when you hear it that way, you guys? I so appreciate that. So thank you for that. We have some more questions that have come in, so we're going to go ahead and jump into those. Butch is asking, will the use of a hot tub have a negative effect on neuropathy?
No, it actually should improve neuropathy because, well, okay, let's look at it this way. In the hot tub, it dilates the blood vessels and allows more blood flow, which should improve the function of the nerves. But as nerve function improves, they go from being numb, where you can't feel anything, to having pins and needles, because you're feeling the pins and needles just because they're waking up, so to speak. If you've ever like slept on your arm, and your arm is like totally cold and numb in the morning, and it starts waking up, and you get the pins and needles, and you're trying to get blood flow to get that to stop. That can happen. So it can seem like it's getting worse, even though it is getting better. So the hot tub should improve the nerve function.
Interesting. Okay. I've just been thinking about this. When someone goes to their medical doctor, they have a type 2 diagnosis. What often, I hear people say, and I'm supposed to be on a healthy diet, or I'm supposed to do this. What is a typical diet recommendation from a medical doctor for someone with type 2 these days? Mostly the ones I see come back with something like a Mediterranean diet. They wouldn't do a ketogenic diet. I haven't had any doctors recommend ketogenic diet. Really?
They usually recommend low salt, Mediterranean type diet with a variety of foods, including carbohydrates, fats, and proteins.
And including fruits. I hear people say that.
Yeah, and fruit.
Sure, they're getting their fruits. Just curious. Okay. All right. Bonita says, I have been looking for the chart on when is the best time to eat like a lion, not a cow. I have the diabetic solution kit that I purchased a few years ago, and I can't find that in the documentation. I don't know that that's in the book, but I do know this. Dr. Saunders, well, in the 6-10 reset, he would always say, be done eating by 6, in bed by 10. Your body works best that way. You produce human growth hormone, etc. And I'm guessing that if you were going to eat like a lion, that'd probably be in the morning would be best. Is that true?
Well, yeah. Eating like a lion, all lions eat is meat. So that would be like the carnivore diet. Whereas a cow just eats grass. But in this kind of a case, since grass is all fiber, we have all the free foods in there that are you can eat as much of them as you want, like cauliflower, broccoli, asparagus, lettuce, cabbage. There's a whole list of foods in there that are cow foods or rabbit food that you can eat as much as you want, and it's still part of the ketogenic diet. So yeah, the idea is not so much that you only eat meat. Some people do, and that's okay, because there's not one diet for everyone. But it actually is really good to get a lot of fiber in your diet. So adding all of the free foods in there is a good idea.
Do you find that some people don't tolerate fiber well?
Yeah, there are certain kinds of fiber. So the beans have some starch in them that some people don't tolerate very well. And depending on the type of bacteria that are in your intestines, you can get gas and bloating from certain types of carbohydrates, including fiber, that will be digested by certain bacteria and create gas and bloating and problems. So yeah, some people don't tolerate certain fibers.
Right. Good information. Okay. Joby says, how can blood pressure be raised when it's too low?
Okay. There's a reason it's too low, and it's important to know the reason it's too low. So if the blood pressure is going low because you have Addison's disease and your adrenal glands aren't working, then that's one thing. If you have your blood pressure is too low because you have heart disease and you're not pumping hard enough, or if it's too low because your brain isn't functioning properly, you've had a stroke or something. Knowing why it's too low is the first thing. And if it's just too low because you're dehydrated, then that's one thing. It can be too low because you don't have enough sodium in your diet, or not enough potassium. I wrote an article for Home Cures at Work on potassium or on dehydration. Because what people are being told is they should drink more water, drink more water, drink more water. And they're depleting their body of sodium and potassium. So sometimes just not having enough electrolytes. So the simple solution for that low blood pressure would be to salt your food, get some salt. They used to have salt tablets for people who worked outdoors and sweat a lot. But also getting enough potassium, which is a little harder. You have to eat high potassium foods like celery. We talked about that. Celery juice, 16 ounces of celery juice has about 1,200 milligrams of potassium, which is a lot of potassium, and it's hard to get that much from anything else. You know, a whole avocado. What's that?
Celery, people drinking celery juice like right away in the morning was a really big trend for a long time. It might still be happening, I guess, but it had a lot of benefits apparently.
Yeah, I've had a lot of patients tell me it really helps. And it turns out they're depleted in potassium. I've seen a lot of that.
Very interesting. Okay. All right. So you don't have to just put peanut butter on celery, which is what we do at our house. You can make a juice out of it as well. Okay. Krish has a question here. Can berberine be taken along with synochroma and nervala?
Oh yeah, absolutely. Yeah, in fact, we were looking into that recently about adding berberine, because as I've been doing research on berberine, it's like, dang, it's good for everything. And there was recently a study published comparing berberine head to head with glucophage, metformin, and it compared favorably. Like you could easily use berberine instead of metformin because it's essentially just as good. So yeah, absolutely, add it on.
That's awesome. Okay. One more question here from Krish. When cortisol levels go up in the body, high stress occurs. When you use supplements such as ashwagandha or phosphatidylserine, help controlling many complications that other listeners have addressed today.
Okay, so that idea of when you have a lot of stress, cortisol goes up. When cortisol goes up, then your insulin resistance is greater. And so it causes your blood sugar to go up. So all these are dependent one on another. And so you end up with this high blood sugar because of stress. And that's what we're talking about today with the injections or the prednisone, taking cortisol. Yes, you can have natural cortisol with a lot of stress. It increases your cortisol, which makes you insulin resistant, which makes your blood sugar go up. And I've told the story about the woman, Julie, that had diabetes only when her daughter was living with her. When her daughter moved out of the house and got her own apartment, she didn't have diabetes. And when her daughter moved back in with her, she had diabetes. She would only get diabetes when she had that kind of stress. So absolutely, stress is really huge. So then the other things we mentioned, ashwagandha. Ashwagandha is the herb that's called an adaptogen. So what adaptogens do is you have this circadian rhythm of your cortisol goes up in the morning and down at night, and up in the morning and down at night. And so what adaptogens do is they just lower that so that it doesn't go up so high, so that you don't get that insulin resistance when it goes up during the day. But it still goes down. So you still have a circadian rhythm because you don't want to suppress your adrenal glands. And that's the advantage of ginseng, ashwagandha, magnolia, all of those, they're called adaptogens, are for the adrenal glands. Now, phosphatidylserine is another issue, and that is a more like a B vitamin that actually kind of suppresses or lowers the adrenal output generally. So yeah, both of those are often used for people who are on high stress.
Interesting. Okay. Can you take berberine with metformin?
Yes, you can take berberine with metformin. They actually work in different ways, but I don't know of any study that shows how they work both of them together. But I would expect that you would have like maybe even double the benefit. I don't know.
Interesting. Okay.
Yeah.
Let's see. Great question here from Greg. He says, I'm on metformin. How does metformin work and what is it doing to my body?
Oh, that's a great question. Okay. So all of the ways metformin works and all of the intricacies and the biochemistry of it isn't really known. But there is one general part of it that's known, and that is it inhibits an enzyme. It blocks an enzyme that is needed to get sugar into the glycolysis pathway. So in other words, it kind of blocks you from using sugar for energy, and it slows down the ability to make ATP. So because there's less ATP and more AMP, adenosine monophosphate, that AMP then tells the body that, oh no, we don't have enough sugar for energy. We better start using fat. And so it's a signal to turn on the AMPK and to start using fat for energy. So what is it doing to your body? Well, it's blocking your ability to use sugar. And do you want to do that? Well, not long term. And if it's too potent, there was another metformin, I'm blanking on the name of it right now, but it was so potent compared to metformin that it would completely block that enzyme, and people were getting liver failure and their muscles were dying, and really high CPK, and they were getting liver failure from it because it just completely blocked the use of sugar. Metformin is a little better in that it sort of blocks the use of sugar. So that's what it's doing in your body, and and because of that, it's being used and studied in cancer too. Because if it blocks the sugar, and cancer can only use sugar, cancer can't use fat for energy, only sugar, then it slows or blocks the ability for cancer to survive. So, and it's actually had some positive studies on that. And so much so that some people that are doing anti-aging are saying everybody should just be taking metformin all the time. And it's got a pretty good track record for not being toxic.
Interesting. Do a lot of people lose weight then when they take metformin? If it's using fat for energy?
Yeah. People do often start losing weight with metformin.
Okay. Okay. Question here from Eric. I believe he's wondering if you could talk about CPT. He wants to ask, I think he wants to ask his doctor for it when he goes back for his A1C reading. So I'm wondering, maybe you know what that is. Otherwise, it might be a therapy. I think I did at one time. Let's see, cognitive
CPT.
processing therapy, maybe.
That's what I was thinking.
I don't know. I'm not totally sure.
Or
for PTSD.
Yeah,
if that's what it is.
No, that wouldn't be it. He's probably thinking about CRP, C-reactive protein, or
that could be. Let us know, Eric.
Yeah. Or the C peptide. Yeah, it's probably the C peptide,
yes.
Which is the C peptide is the insulin. It's part of the insulin protein that's made that gets cut off, and that C peptide tells you that your pancreas made that insulin, and it wasn't something that was injected. So that's often used in people who are injecting insulin. They want to know whether the pancreas is making insulin.
Okay. Let's see. Genevieve says, what can cause the liver to have abnormal high numbers? The doc said to stay off any carbonated drinks, wait a month, and retest the liver. What are your thoughts?
Mostly if you have normal high livers and you're have either pre-diabetes or type 2, mostly that's from what's called fatty liver, non-alcoholic fatty liver disease, because alcohol is a toxin that can produce fatty liver, but sugar, especially fructose, is also a toxin that can produce fatty liver. And so the reason they tell you to get off all of those beverages is because they contain high fructose corn syrup, and all that fructose is causing more fatty liver. You know what the best thing to do is? Just start burning fat for energy. That's do phase 1 of the program would be so much more comprehensive than just stopping the sodas.
Okay. Eric says, Dr. Saunders said on the last webinar, low carb, low protein, and now high fiber diet. Is that right?
Yeah. What I was talking about last time is what I tell all my patients. There's only 3 things you need to avoid in life: carbohydrates, fats, and proteins. Everything else is okay. And they always stop and think, well, then what can I eat? And so then I start explaining the high fiber diet and what that means. Because actually fiber grows the good bacteria in your intestines, and it doesn't, well, as long as you tolerate it, it doesn't cause any problems. There's no illnesses associated with a high fiber diet. And I was talking about some areas where they have a gathering societies, people. They will eat 100 grams of fiber a day, and of course they're getting a lot of sugar and other stuff with it. But 100 grams of fiber a day is like 10 times what the average American eats, and they don't have any issues. They don't have any bowel problems. They never get diverticulosis or diverticulitis or hemorrhoids or any intestinal problems. So hey, fiber. Who knew?
All right, guys, this has been another wonderful webinar. Thanks for hanging out with us today and talking about, well, we've talked about lots of stuff, but we will be back next week again to talk about type 2. So tell your friends, bartonwebinar.com, and Dr. Saunders, thank you again. Go be with your lucky patients.
Okay, adios.
See you next week. All right, you guys, if you have any questions, again, bartonwebinar.com. I would also love to hear from you. I'd love to hear your story, how things are going. Leslie at bartonpublishing.com. Shoot me an email. Love to chat. So we'll see you guys next week. Thanks again for taking time out of your day to be with us. And I think that's it. Thanks, guys.